Today we're here with Harry. He is a patient that received all an X procedure with us, and he's just going to talk a little bit about himself.
My name's Harry McClay, and I live in Swinksville now. I was a master electrician. I retired and went to work at Home Depot. And then I decided to retire. And again, I decided to go and have something done with my mouth. I had implants done prior to that, about 10 or 15 years before that. And what happened was they were removable when you, like a snap in type of thing with the dentures. And I didn't want to go through that. When I saw the advertisement and checked it out. And the main thing I went and I saw was the number one thing is how clean a place is and how helpful the staff is, how well trained they are. And I really felt comfortable after meeting with the doctor, especially. And then the financials, Neil was great with the financials. He worked things out a little bit to made it a little bit easier for me and my wife. Yeah, there's a little bit of pain, but it's good to have it done while you're awake, I think. And, you could go to sleep and have it done, but guess what? It's nice if the doctor says, hey, move your head a little bit or this or that to get a little bit better angle at it. You're going to be better off afterwards to have that done. And so we had it done and everything went smooth with local anesthesia. And that wasn't a bad thing at all. Once they go and they put a couple needles in there, then it becomes numb and you're awake the whole time. It was bearable. So we got the thing done, and then it was the prep work too. They had this right equipment to do it. They had a thing that spins around your head and it goes and x-rays your whole head and your mouth. So then they go and everything's by computer nowadays, and they scanned my mouth to it and then figured out where they're going to put the implants at, which is another thing that they do. So after we had it done, came back the next day for a follow-up. Everything went according. Just took ibuprofen and ate a lot of soup for a few days, which was no problem there. I like soup. But anyway, you want that thing to give the best chance to go and make it tight, because that's what's going to hold the new plate in. So after we had that done, we did that, and everything solidified, and we turned around and they rescanned it and they redid a plate. We were real happy with it. And then I got partial for my insurance. I had MetLife from working at Home Depot, and I got like $2,000 towards it. So it's something to check into whether your insurance is eligible or not. Neil would work with you on that to tell you whether you are or you aren't. So it was nice. It was really unusual. But the biggest thing was, like I said, I had the implants for removable. So you had to go and get them things out of there. So you really got to have somebody to know what they're doing. So that's pretty much the story on it. You can see how nice it is. And the people and the staff are wonderful. And I went to them if I didn't believe in them. And I think that you were going to go and enjoy the experience of having a teeth like you're 19-year-old again. Like these girls here have the real teeth. They can eat anything they want. Guess what? So can I.
You talked about, the first time that you had dentures. How were your teeth before you even decided to get dentures? Like, what made you go ahead and do that first procedure?
Well, I was in Vietnam, so some of it was not getting good dental treatment.
Yeah.
And there was a lot of cavities and a lot of pain. I went through a lot of things. And the dentist I went to was pretty good, but he wasn't set up like today. And this is what's nice about it. The other one was removable dentures, but he had put it on an angle that didn't really snap in properly. It's a few little defects. So you got to have somebody that knows what they're doing.
So you started off with the PMMA material, and then you moved yesterday over to the zirconia material. Why don't you tell us a little bit about your experience just with the PMMA material? I know you mentioned that it cracked once before.
The cost was a factor. And it was explained to me that the PMA, they're not as strong as zirconia, but there's a cost factor involved in it. So I took a chance on the PMA, and then, one of them cracked. Me and my wife talked about it with Neil, and we decided to go with zirconia. And you can see now that it's like, they're like porcelain, but there's no pain. All they do is screws, unscrew the screws and put them back in, new screws in basically. And the thing's all ready to go.
How life-changing has this procedure been for you?
Well, my wife loves it. I play pool, and some of the guys were asking me about it, and they were interested in getting it done too, but they're living with a lot of pain and decay and things like that. But yeah, it's life changing in the sense that I'm just like when I was 19 now. You can eat the wings and you can go right off the bone if you want to. There's just so many things that makes things better, and it's just comfortable. You don't have that. And what I was found out from research was this affects your body, your whole body, your mouth affects it. You could have a heart disease because of bad teeth. There's a lot of things to consider when you're having this. It's not just a one, well, I look pretty. No, it's there's other factors involved.
Is there anything small that changed when you got this procedure that you didn't even think of before you got this procedure done? Some patients say that, they used to get broccoli stuck in their teeth. And now with this procedure, they do feel like they get something stuck again. And it was a good thing that they feel that way. Is there anything, in your opinion, that was such a small little change, but it does make a world of a difference?
Everything's a big change. There's no small change. I mean, it's so comfortable. Like I said, this is like you're 19 years old chewing again. You can eat whatever you want. And going back for the follow-ups is important too. I mean, there was never an issue making appointments. They worked around your schedule and just perfect. You'll enjoy ADE.
Was the surgery at all hard for you? Like, if you go back and you think about it, did you think the surgery itself was difficult?
Yeah, it's not the easiest thing, but guess what? It's well worth it. That's the most important. The goal afterwards is what you got to look at. You don't look at you get it done, and you got to have that good doctor to do it and the good place to do it. They make the thing right there, and then if you want to upgrade, you upgrade to the zirconia. They're hard, but they fit perfectly. Everything's perfect with them.
Was there ever a moment where you questioned your decision of getting the surgery done?
No. We can see them now. There's no question.
Yeah.
That's why I'm here now, because I want to go and promote people to go and say, "Hey, let's do it." You can. It'll help your whole lifestyle, everything about you, and especially if you're younger. I mean, the, I'm older, but guess what? I'm going to hang in there for a while. And if you're young, you're going to be hanging in there a lot longer. So why not be able to eat what you want all along? That's all.
If someone was listening right now to this podcast and they were putting off this procedure, what would you tell them right now to change their mind to say, go ahead and do it?
But you got to weigh your own decision. My case was that these these old implants didn't work, and my teeth. This thing was falling out. The denture was falling out, and things like that. You got your own decision to make on why. I mean, if you had pain, if you were to worry about the looks, I mean, and they're all the big things in your health. Like I said, it could lead to bad heart. So, I would do it in a minute. It's worth every bit of the money.
Is there anything you wish you knew about this procedure before you started?
Everything was explained pretty good by by where I went to. And the internet is just like this is one of the things, the podcast. This is educating you, and then you're going to find out, everything about it, and you're going to go and try to go and yeah, I'm here to help people decide where to go and to consider ADE because, like I said, if it's clean, that's number one because you don't want no disease afterwards and all the technical stuff, the X-ray equipment, the dental chairs, everything about it is made for doing this, and they go first class with the doctors. These guys are really good doctors. You might want to check their credentials out to see that.
So, yesterday you got your zirconia final teeth. Was there any complications during that time?
There was a small problem, and it was taken care of. This is why you have to have what we talked about, somebody that knows what they're doing. One of the screws happened to break in the implant. The doctor went up there and he repaired it. Not everybody's going to be able to do this. And guess what? It's repaired perfectly because now it's nice and tight and there's no problem. There was no real pain there involved. It was somebody that knows what he's doing again, because when you have a broken screw in there, you gotta take it out and the implant and the abutment came out. He put a new abutment in. And this was all done really quick and comfortable in the chair.
Do you have anything else you'd like to let the patients know?
If anybody has any questions, you can text me.